All right, all right. Hello, 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 and happy Thursday. And so, welcome to Demystifying Health Insurance for business owners, entrepreneurs, small business owners, however you classify yourself. All righty. And so, tonight in this on this workshop, I'm going to be going over breaking down some myths, some common myths that people have about health insurance, um, and then going into the different types of health insurance that is available for entrepreneurs. Okay. And so it's going to be about 45 minutes, depending upon if there's any questions or not. So let's go ahead and jump into it. So, welcome, welcome, welcome. And so, before I get started, hold on a minute. All right. And so, before I get started, let me tell you just a little bit about me so you know who you're talking to and why I'm qualified to go over this information tonight. And so, my name is Katrice-Daniels, and I am a licensed insurance specialist. Okay. And so, I specialize in health and life insurance. I primarily work with business owners. However, I can help anybody. Okay. And so what I do is I help business owners, entrepreneurs, freelancers, small business owners, however you classify and identify yourself. I help you guys navigate through your health insurance options, but through education. And then I help you to enroll into affordable, comprehensive insurance that does not break the bank. And I am also the founder of INSURE Black America, and that is my community initiative, and that is to close the coverage gap for African Americans. Okay. And so I've been licensed since 2018, in and I'm licensed in the states of Arizona, Florida, Georgia, Louisiana, Kentucky, Mississippi, North Carolina, South Carolina, Tennessee, Texas, and Virginia. And I'm also licensed in life in Florida, Georgia, and Tennessee. I am a mom of three amazing children who I love dearly, and they are 22, 19, and 8. And so tonight I'm going to be dispelling some myths around health insurance, and then I'm going to go into what options are available for business owners. I'm going to a little bit of detail about how each option works. Do a little Q&A, and then I'll tell you how you can connect with me or work with me if you're looking to work with me. Okay. And so, talking about myths around health insurance, the first myth that I want to dispel is that the least expensive monthly premium is the least expensive health plan. Okay. And so, I can say from my experience that that is a myth. Okay. That's a lie. Lower premiums don't necessarily equate to overall lower out of pocket cost insurance. Okay. And actually, it can be quite the opposite because the more you pay out of pocket up front, the more the plan will cover on the back end. And the less you pay up front, the more you'll have to pay on the back end. So, um, especially with like if you're looking at marketplace insurance, with the marketplace, a lot of times you can find a plan for $0, and you're like, "Woo, yeah! I gotta pay nothing for no premium. I got some insurance. I'm just doing it right." And so then when you go to use it, if you haven't read your summary of benefits, which I tell all of my clients before we enroll into anything, you're going to look at that summary of benefits. You're going to put your eyes on it because you need to know what it is that you're going to be paying out of pocket. Okay. And so you get that $0 plan through the marketplace, and you're like, I did that. And then you go to use it, and you're like, what is this? Like, why do I have to pay if I have insurance? Well, you may have to meet the deductible before the plan will pay for any services. Okay. Or you might have you might get a copay for your primary care that doesn't, you don't have to meet the deductible first. However, if you need to go see a specialist, you have to meet the deductible before the specialist copay will kick in. So it's very important that you know, when you're looking at a plan, that you're not just looking at the premium. You have to look at the overall plan itself, the out of pocket costs and everything. And on my live I did yesterday, I think it was yesterday, I went in depth on how to um, conduct a health needs assessment, and that you need to do that before you start looking for health insurance. Okay. And so if you're somebody who goes to the doctor a lot, and you are, if you're somebody who goes to the doctor a lot, what do you need? Goodbye. Okay, so if you're somebody who goes to the doctor a lot, right? If you have a chronic condition, or if you need a lot of medications, you take a lot of medications, you're going to want to find a plan that has more comprehensive coverage, even if it is a higher premium, because it'll cover, though, in the back end when it comes to your out of pocket costs. It'll actually cover more, and you'll spend less. Okay. Now, the second myth I want to dispel is that health insurance can only be used for physical health care provided by a doctor. Okay. And so that's a myth. Um, Health insurance, they cover many aspects of your physical health, but they also have coverage for behavioral health and mental health. Okay. And also, if you're interested in alternative things like acupuncture or chiropractic services, depending on the plan, those things can be covered as well. So it's not just for you going to the hospital or getting tests, or being admitted into the hospital. It covers other things as well. The third myth, the cost of service indicates the quality of care that you should expect to receive. Okay. And so the cost of seeing a doctor, it can vary significantly depending on who you go see, if they're specialists and things of that nature, depending on where you live. And so just because one provider costs more, it doesn't mean that they will deliver higher quality of care. Okay. And so if you go to a physician that costs less, you still may be getting a higher quality of care. The cost has nothing to do with the care. Okay. And so if you are in search of a doctor, you may want to, see multiple doctors, or call and speak with the receptionist. Because sometimes, and this is just speaking from experience. Sometimes, if the receptionist or the office staff is rude or nasty, the doctor normally isn't the greatest. So you don't want to only just look at the doctor, and see his bedside manner, but you want to look at his staff as well and see, how do they treat you? How do they act? Um, because dealing with people who are rude or ill mannered, and they don't know how to provide good customer service, it doesn't make for a pleasant experience when you go to see the doctor. Um, and nobody likes to go see the doctor anyway. And so you definitely don't want to have um, a bad experience when you already are, not something that people want to do anyway. Okay. Now, selecting in network providers um, for any type of service will help you save on your out of pocket costs, because normally if it's a HMO plan, then it's not going to be covered if it's out of network. And if it is a PPO plan, it will be covered, but you will pay a higher cost share. Okay. So selecting in network providers would be one way to help save on some of your out of pocket costs. And then the last myth that I'm going to go over, um, this one is one of the ones that I cannot stress enough. Um, if I had no issue with my plan this year, I should just select the same plan in open enrollment. Um, that there I caution against, because one, when it comes to health insurance, the rates go up every year. Okay. And so the plan that you're on this year, you may only have a $2,500 deductible, and you may not be paying for a premium. Now this is the marketplace. I'm just giving an example of the marketplace. And so you might have a $2,500 deductible and your premium may be zero. Okay. And then come next year, you stay on that same plan, the deductible may go up to 3,000, and you might now have to pay a premium, just depending upon, your subsidy. And so it may seem like it's a good idea to stay with the same plan. It really could end up costing you later. And so health needs shift from year to year, which is why I'm a really big proponent of doing health needs assessments. Because if you have watched any of my lives or paid any attention to what I've been talking about for the last 2 years, you will know that I have constantly, from the beginning, saying you must do a health needs assessment. It's really backwards to go and try to just look at a plan from the premium cost, when you don't know what your health needs are, or you haven't sat down and wrote them out and figured it out, what your health needs are. Things change from year to year. Hell, things change from month to month. Okay. And so you might be healthy here in May, come June, something could happen and you have to take medication, or, you could get in an accident, or anything could happen. And so health needs can change very quickly. Okay. And so you want to think about your needs. When it's open enrollment for the marketplace is November 1st through December 15th, unless, they extend it. And so within that time frame, you want to sit down and you want to do a health needs assessment. And so what a health needs assessment is where you sit down and you look at what are your current health needs now. Okay. And then what do you project they're going to be in the future? Okay. Do you think your health needs are going to stay about the same? Do you think you may need to take a new medication? Do you think they may be taking away a medication? You know, what do your health needs look like? Okay. And then how much are you currently paying for your health needs? Okay. Is what you're currently paying, is it okay? Is it within your budget? Would you like to reduce what you're paying? I know you don't want to pay more, right? And so you want to think about that. And then you want to think about, okay, how much have I budgeted? You know, if something were to happen and my health needs were to go up, something happened that I didn't anticipate and my health needs were to go up, you know, is that in my budget? Can I fit that in my budget? Okay. And so once you sit down and you do a complete assessment of everything, then you go and you start looking for a plan that will cover your health needs and save you the most money out of pocket. Okay. Most of the time, it's done backwards because we're just like, I need health insurance. And so I'm going to run and go get some health insurance. And you don't sit down, you don't assess your needs. And then you got a plan that's not covering your needs. You're paying more out of pocket. And you're saying that the plan is garbage when in reality, you didn't do your due diligence and figure out how much your needs are. Okay. So I do not recommend anybody to just keep the same plan that they had this year, unless it covered your needs. And when it goes up, will it still cover your needs, or do you need to try to find another plan? So I do recommend doing a health needs assessment um, every year, every single year, doing a health needs assessment. All right. So now that we have gotten through all of these myths about health insurance, let's get into what options are actually available for business owners. For business owners, okay? So there's COBRA, there's the health insurance marketplace, or the ACA or Obamacare, short-term plans. There are health share plans, and then there's supplemental plans. Okay, and so what is COBRA? COBRA is the Consolidated Omnibus Budget Reconciliation Act. Okay. And so basically, what COBRA says is if you've lost your job or had your hours reduced or experienced any other qualifying events, there's options available to you and your family so that you can maintain your health insurance. Okay. And so this provides a way for workers and their families to temporarily maintain their employer provided health insurance when they've lost a job or a reduction in hours. And so if you're a business owner and you've decided that, you know what, I'm going to go full time in my business, and I'm going to walk away, and you're like, but what am I going to do about my health insurance? Okay. Cobra is an option. Okay. And so it offers a continuity in coverage, meaning that your coverage will be the same, nothing will be changed. You continue to see the same doctors and receive the same health plan benefits that you were previously getting through when you were at your job. Coverage for your dependents, so your spouse, your former spouse, if they were still on your plan, and your children are also eligible for COBRA coverage, um, even if you don't sign up for it. So if you decide that you don't want COBRA, but you want to make sure that the children still have coverage, you can get cover or your spouse. You can get coverage on your dependents, even if you don't sign up for COBRA. Now, also getting COBRA helps to avoid a lapse in coverage, um, because when you separate, you have, I think it's 60 days. Yeah, it gives, and that's the next prompt, a generous time to enroll. You have 60 days to enroll in COBRA once your employer sponsored benefits end. So if May 31st is going to be your last day working on your job, you have from June 1st to July 31st to enroll into COBRA. Okay. Now, you will receive a notice from your employer with information about deadlines for enrollment. So you'll get all the information that you need. If you're wanting to keep your coverage, you will get that information. So you won't, be in the blind about how do I go about doing it. Okay. Now, while COBRA is temporary, in most circumstances, you can stay on COBRA for 18 to 36 months. Now, this coverage period provides flexibility for you to find other health insurance options. Okay. Now, you will have to pay the full cost. Okay. Unless your employer is really generous after you separate and decides to continue subsidizing the cost for you, you will have to pay the entire group rate premium out of pocket plus a 2% administrative fee. Okay. So, again, when you're doing your health needs assessment, one of the things that you're looking at when you're looking at all of these options is, okay, can I afford the COBRA premium? Because it's normally pretty high. So can I afford this every single month? Okay. Now, the next option that is available to business owners is the health insurance marketplace or Obamacare or the Affordable Care Act, ACA. It's all the same. And so, what the health insurance marketplace is, and it's where you can purchase private, individual, or family health insurance and receive income based subsidies to make coverage and care more affordable. Okay. And so the marketplace was designed to provide coverage for individuals and families who were either uninsured or already buying their own insurance. Okay. And so this would include self employed people who are employed by a small business that doesn't offer health benefits, and people who have retired before the age of 65 and are too young to be covered by Medicare. Now, you're not required to buy your coverage through the marketplace, and there is no longer a penalty for not having coverage on the federal level. Okay. Now, some states do still have the penalty going. So, California, DC, Massachusetts, New Jersey, Rhode Island, and Vermont. Now, Vermont doesn't have a financial penalty attached to their mandate. Um, but they still have a mandate where you must have health insurance. Um, and so, but the other states, they do have penalties for you not having health insurance. And so if you live in one of those states and you're looking for health insurance, you either need to get on the marketplace or you need to find some type of coverage elsewhere. Okay. Now, if you don't buy your coverage through the marketplace, you will not qualify for the premium tax credits or any of the cost sharing reductions. Okay. Some of the plans have cost sharing reductions. And so you must buy through the marketplace. Okay. And if you decide to purchase off exchange, because a lot of the marketplace carriers, they do have an off exchange for people who don't qualify for the marketplace. If you decide you want to buy off exchange, you're not going to qualify. And so you'll have to pay full price. Okay. Now, there is an open enrollment period for the marketplace. Okay. And so, like I said, from November 1st to the December 15th is when you are eligible. The marketplace is open and you're eligible to go ahead and enroll without having to have a special election period. Okay. And so when you enroll by the 15th, your coverage of December, your coverage will be effective January 1st. Now, should they choose to, extend it past, then like this year, they extended it to January 15th. And so if you got your coverage after the 15th of December, it wouldn't be it wouldn't be effective until February 1st. So if they do it like that next year, it'll probably work the same. As long as you get it by December 15th, it'll be effective January 1st. And if you get it after that, where they extended it, then it will be effective February 1st. And so outside of the annual enrollment period, you must qualify for a special election period. Okay. And so special election periods are triggered by a variety of qualifying life events, and they give you at least 60 days to select a new plan. So if you're on marketplace insurance already and you have a baby, or if you get married, or if you move, that gives you a special election period. Okay. And there's many other special election periods, but those are just like the most common ones. Okay, so the next option available are short-term plans. Okay. And so short-term medical insurance, they're also called temporary health insurance or term health insurance, can provide a temporary solution to help fill in gaps in coverage and is a flexible health insurance coverage solution when you need coverage for a transition period in your life. So if you're leaving the marketplace, say for somebody who you're leaving the marketplace, you're leaving your job, say like in September, right? And so you've made like quite a bit amount of money, and for your household size and the income that you've made, you wouldn't qualify for subsidy for the rest of the year. Okay. So a short-term plan may be an option that you want to look into, because it'll take you to the end of the year, and then obviously if you've left your job, your income has decreased. And so come next year, when it's open enrollment in November, you could use your projection for next year um, to qualify for subsidy. But for this year, you could use a short-term plan and it'll cover you for the rest of the year. Okay. Now, short-term health insurance coverage varies greatly just depending on the plan and the insurance company that you buy from. These types of plans, they are not, hold on, okay. So these types of plans, they are not required to apply to comply with ACA guidelines. And see, ACA plans are required to provide certain levels of coverage called minimum essential coverage. Short term plans are not required to meet these same standards. Okay. So they may or may not cover preventative care, they may or may not cover urgent care, they may or may not have coverage for prescriptions. A lot of times, short term plans won't cover maternity or maternity visits. They may or may not cover um, mental health visits. So it really just depends on the carrier that you're looking at when you want to purchase a short term plan. Okay. Now, short term plans, they are not a part of the ACA. So they don't have to comply with the pre-existing standards. Okay, so with the ACA, you if you have a pre-existing condition, so if you have something like lupus or scleroderma or high blood pressure, diabetes, those are pre-existing conditions. On the ACA, you cannot be denied with those conditions for health insurance. Short-term plans, they don't follow that same rule, and so they're underwritten, meaning that they're going to look into your background, they're going to ask you health questions, and they're going to see, would you be a good risk or not. And so they were not they're not meant for like long-term coverage. You can get them depending on your state, you can get them for up to 3 years. However, they were only created to help fill in temporary gaps in coverage that can occur in certain situations. um, at the end of the day, it really just means to me when I'm speaking with someone, is it really just depends on your health needs. Okay. Because if you're someone that's really sickly or you take quite a bit of medications, I'm not going to even discuss a short-term plan with you because they're not going to cover those pre-existing conditions. They're not going to cover your medications. And so you would just be paying money um, for a plan that's not going to meet your needs. So it would be a waste of money. Okay. And so then the next one is medical health shares. Okay. And so medical health shares, I learned about these about when I first got into insurance 2 years ago. Well, not first. I started in 2018, but in 2020, when I went out independent, is when I first learned about medical health shares. Okay. And so what medical health shares are, um, they are health sharing plans provided by different organizations whose members share medical costs. Okay. And so if you're not eligible for the tax credit, um, and you're pretty healthy, you don't, have a whole lot of medications that you take or anything like that, you may want to look into a health share. Now, as part of a healthcare sharing plan, you're responsible for paying a certain share amount each month. Okay, and so that's kind of like the premium, and then you're also responsible for an annual unshared amount, which would kind of be like a deductible. Okay, and so once your medical expenses that exceed your unshared amount, then the plan would share your expenses. Okay, and so medical health shares are not insurance. Okay, now the unshared amount, which is usually like your deductible, can be anywhere between $300 to $500 for individuals, $1,000 for couples, and 9 to 5,000 for families. Now those are just rough estimates. It varies, per plan. Okay. And then the monthly cost ranges. So the monthly share amount that you would pay every month can run anywhere from 64 to $627, just depending upon the plan details and coverage. Now, beyond all that, all medical expenses are shared among members of the organization. Okay, so once you meet your unshared amounts, then anything else you would be eligible to share to the organization. Now, healthcare sharing can be great for people who are generally in good health, are not eligible for tax credit based on your income, lack access to insurance through an employer or government program, you aren't able to get coverage because you missed an open enrollment and you don't qualify for a special election. If you only want or need catastrophic coverage, and so catastrophic coverage is pretty much like, if you get into an accident or something, catastrophic happens, you just want to make sure you have insurance in case, for the what ifs. Okay. And then if you can't afford your current health insurance premiums, you may want to look into a health share because it may be less costly for you. Okay. And now, again, healthcare sharing is not insurance, but the plans do count as insurance under the Affordable Care Act. And so basically, that means that more affordable healthcare benefits for you while avoiding the tax penalty for going uninsured. Now, there's no tax penalty federally, okay? But if you live in one of the states that I mentioned earlier, you may incur a penalty for not having insurance. And so, if you're in a health sharing plan, then that would count as insurance, okay? And so some other pros for healthcare sharing um, over insurance would be lower cost. The monthly cost of health sharing is usually much lower than insurance premiums. Now, even though the rules are different for what's covered, depending upon the health share that you're in, um, it still may be more cost effective for you to look into a health share. Also, the annual unshared amount is normally much, much lower than deductibles on low premium or catastrophic plans. You have your choice of providers. There's no network requirements. So you can go see whomever you want, whenever you want. There's no referrals that you have to do. Um, and so, if you're somebody who you don't want to network and you don't want to pay um, out of network costs either, then you may want to look into a health share because there is no network restrictions. Um, Now, if your doctor won't accept your health share plan, and you have to pay out of pocket, the health sharing plan will reimburse you the expense. Okay. Now, healthcare sharing plans are not required to cover pre-existing conditions such as cancer, diabetes, or lifestyle related conditions like smoking. And those who have them may be declined membership or won't have the conditions fully covered for a year or more. So just depending upon what health share you are looking at joining, they may not cover it or they may cover it, but you may have to wait. Like one of the health shares that I work with, you have to wait, I think it's 2 years before they'll cover anything related to the pre-existing condition. Now, if a new condition arises because of the pre-existing and you get a new diagnosis while a member of the health share, then that will be covered, okay, because it's a new diagnosis. And healthcare sharing plans typically don't cover essential health benefits like wellness exams or mental health counseling, okay. So we're almost done. And so the last plan that we're going to talk about is supplemental plans. Okay. These are my absolute favorites. I love supplemental plans because one, you can use supplemental plans with any of the other options that I went over tonight. Okay. And so what a supplemental plan is basically like a gap plan for insurance. Okay. For health insurance. You know how when you purchase auto insurance and you can get the gap, or when you purchase a new car, you can get the gap insurance. So, if there's any gaps between, you know, what the insurance will pay and say your car gets totaled, the gap insurance will cover so that you don't owe that amount, right? And so supplemental plans work the exact same way. Okay. So supplemental plans, you can get them to cover the cancer coverage is a supplemental plan. Dental and vision are considered supplemental plans. There's accident policies. My favorites are the hospital indemnity plans. Okay. There's plans for the heart. So if you're having heart issues like, you know, if you have congestive heart failure, or if you've had a heart attack or a stroke, um, when I'm working with somebody, if they're taking blood pressure medication, I'm going to offer them, I'm going to present to them a um, a stroke plan, because you never know what could happen, and if you were to have a stroke, it would pay out, and so, you know, that money that and it pays out to you. It comes in a check to you. So that money you can use to pay your deductibles, or your pay your deductibles or your co-insurance, or you can use the money for your living expenses. Now, I recommend that you use it, to pay your medical bills, so that's not a stressor that you're having while you're trying to recover. However, the money comes to you in a check. It does not go to the providers or to the hospital. So, however you see fit to use that money, it's up to you, because it comes in a check to you. And that's what's so great about the supplemental plans, is that they have that flexibility to where you can use them to pay your medical expenses, or you can use them to pay your for your living while you're trying to recover, or depending upon how much you choose when you purchase it, you may be able to pay for your out of pocket costs and have money left over to help with your living expenses while you recover. So supplemental plans are a great addition to any of the other options that are available, okay, because it's saving you money out of pocket. Okay. And so that is all that I have on the plans. Are there any questions? Um, Let me see. Are there any questions in the chat? On the comments? Okay. Let me see. I don't see any. Oh, cool. All right. So if there's no questions, I'm going to go ahead and end it. So I really do hope you found value in this workshop. If you did, please do go ahead and share it out so that others may find value as well. Oh wait, hold on, what's this? Okay, no, that's not it. Oh, no, okay. So now, if you're looking to work with me, if you would like to work with me, you can go to insureblackAmerica.com and you can book a free health needs assessment with me. It doesn't cost anything to sit down and talk with me and to go over your health needs, and then to find a plan, a comprehensive health plan to get you, and then I go ahead and I get you enrolled. Um, Health needs assessments takes anywhere, it just depends. Can go anywhere from 45 minutes to an hour. If it's longer than an hour, normally it's because there were questions and I had to answer questions, and all of that good stuff. I love answering questions. I don't like to just sell people insurance. I want to make sure that you understand exactly what you have, because one of the things that happens is that you just get some insurance, you don't know how it works. And there are a lot of benefits that you can get from your health insurance that people just don't know about. There's a lot of different perks and things that they have, and that if you're not aware of that, um, you know, you're not going to use it, and it could be, something that could really help you to, get your health back on track if it's, not as where you want it to be. And so I go, to make sure that you understand, you're not going to be a scholar, but you will have enough information to know how your insurance works, and you'll know how much you're going to be spending for the year, if everything goes as planned. Okay. So again, I hope you found value in tonight's broadcast. Share it out so that others may find value. And I hope you have a great rest of your Thursday. Take care. God bless. And remember that together we can close the coverage gap for African Americans. Have a great one.